A cholera case has been confirmed in the Nelson Mandela Bay Municipality. One patient from Walmer Township in Gqeberha was admitted to hospital after falling sick. Athol Trollip is ActionSA's provincial leader in the Eastern Cape. He's been following developments on this possible cholera outbreak, and he joins us now via Zoom. Thank you for your time, Athol. First of all, do you know what the status of this person is who was taken to hospital after falling ill?
No, I don't know what the status is today, Clement, but we've been informed that the patient was taken to hospital. They sent tests out to be conducted. The test came back positive. The patient is still alive as far as I'm concerned, but we're very concerned that we now have a case of cholera in Nelson Mandela Bay, which is a really terrible time of the year to have a cholera case because there's an influx of people into the Eastern Cape coming home for, traditional ceremonies, coming home for Christmas to visit their families, and also influx of tourists into Nelson Mandela Bay, so it couldn't come at a worse time.
Mm-hmm. What has the Nelson Mandela Bay Municipality done since this confirmed case?
Well, I really must say that I was bemused by the municipality and the Department of Health's response, because they said that they'd sent out a crack team of people who know how to deal with this, and they were going to be encouraging people to wash their hands and to take care of, good sanitation practices. Now, that's very, very difficult in areas like the Walmer Township where this outbreak happened, and other townships in Motherwell in particular, where people are living with sewage all around them, sewage spills that take months and months and months to be sorted out by the Nelson Mandela Bay Municipality. And then, of course, there's intermittent supply of water. So how do you wash your hands and make sure that your sanitation practices are good if you don't have water? And then it doesn't matter if you wash your hands and you're living with sewage around you, because that's exactly the kind of environment that cholera likes to live in. And unfortunately, I can give you a number of examples. One was in Motherwell recently, where we've been waiting for over 4.5 months for the municipality to do something about a group of families, especially elderly people, that are living in, established RDP houses. They've been living there for years, but the sewage keeps rising up through their toilets and their drains, and their yards are covered in sewage. The road, the street is covered in sewage, and the municipality does nothing about it. I've spoken to the mayor. I've spoken to the executive director of infrastructure and engineering. I can't tell you how many times the local councillor, the mayoral committee member, everyone makes promises, but they just don't fix it. So the people are living in sewage in their homes.
But what's the plan? Does the Nelson Mandela Bay Municipality have a plan? Because once a case has been confirmed, you want to try and arrest the spread as soon as possible.
Well, their plan is they're following who had come into contact with the person. The person had gone to a funeral, so they have to check all of those people. But I'm afraid the plans are too little too late. In the Eastern Cape, for example, in April, Mr. Mashaba and myself and hundreds of our members went to hand a petition in to the Premier, Oscar Mabuyane. Amongst some of the things in that petition was us highlighting the fact that over 50% of the water treatment works, wastewater treatment works in this province are completely dysfunctional, as per the Public Protector. A city like Buffalo City, for example, the other metro in the province, 12 of their 15 wastewater treatment sites are inoperable. They're not working. So all the sewage that flows into those wastewater treatment plants is just flowing directly through it and into the rivers. And two of the main rivers in Buffalo City are the Nahoon River and the Buffalo River. And both of those rivers supply drinking water to the people of Buffalo City. So we are actually litigating against the Buffalo City municipality for their poor wastewater treatment. And because once raw sewage runs into a river and ends up in a dam that supplies the city with water, and if that water treatment works that is supposed to clean that water and make it potable, if that's not working operably, then you are really facing a potential crisis. And, cholera kills people. And cholera is an archaic kind of disease. But when you get cholera, people die. And that's a looming crisis in the Eastern Cape because of the state of poor wastewater treatment.
And do you get a sense that municipalities are investing a lot in fixing those water systems? We just had a conversation now with someone from the Water and Sanitation Department in the Northern Cape who again was decrying the lack of investments even by some municipalities in repairing that water infrastructure, which often also leads to the problems that we face.
Yeah, unfortunately, Clement, the current government is not really good at maintaining anything. So infrastructure maintenance is probably their weakest point. And unseen infrastructure like water infrastructure or sewage infrastructure that runs under the ground gets the least attention and least budget. I read today in the Weekend Post in the Eastern Cape that one of the water treatment works in Buffalo City is completely inoperable. I've been telling the Premier that, and he hasn't even bothered to answer our petition. But they said there's no budget to fix it. So if you admit that a wastewater treatment works, one of the biggest in the city, is broken and ineffectual, and you haven't got money to fix it, then there's actually no prioritization to get this thing sorted out. And Clement, apart from the health hazards that this situation presents to people of the Eastern Cape, agriculture is one of our biggest forms of employment, especially in rural areas, and we export a lot of agricultural products, perishable products, that are irrigated with water out of our rivers. And if you have high volumes of sewage running into those rivers, you will have an E. coli buildup. And if any of your exporting food that is being exported, perishable products, primary products, is found to have E. coli contamination, then they can shut down those exports, and that will mean more losses of jobs in the Eastern Cape. So we have a government that is clearly overwhelmed. They cannot deal with infrastructure maintenance like wastewater treatment and water treatment. And this manifests itself in cholera, cases of cholera like we've seen now in Warmer, but also potentially can have devastating economic consequences to the agricultural industry. So we've been saying for so long now that this current government clearly can't cope, and the time has come for us to get a government that can cope. And I hope that South Africans will fix that in 2024, because that's what elections are about. Elections are about evaluating whether the current government can do the job, and if they're not doing the job, get rid of them and get another government that can do the job. And ActionSA believes that we could do that job much better.
Athol Trollip, thank you so much for making time for us.